Hi, my name is Carrie Sand. This is my head to toe video for Maryvale University class Advanced Health Assessment Nursing 612. This is my volunteer 18-year-old patient. Before we started, I washed my hands, he emptied his bladder, we got his height and weight and checked his vital signs, which were all within normal limits. We also used the Snellen chart for his far vision and Jaeger chart for near vision. He changed his clothes into something he feels comfortable in for the exam. I would do an overview of my patient. His head is midline, so is his trachea. There's no JVD noted, no goiter either, no nasal flaring, and from what I can tell, no use of accessory muscles. I would start with his skull and head and let the patient know I'm going to feel your head for any bumps, lumps, indentations, okay?
Okay.
So I would feel, and it all feels normal. He has nice thick hair. I would check his scalp for any signs of lice or dandruff or alopecia, and I don't see any. I would feel for lymph nodes. I would start in the back with the occipital, post-auricle, pre-auricle, submandible, submandible, cervical, post-cervical, tracheal, clavicular, and then I'm going to have you lean forward like you would give yourself a hug and check supraclavicular, and all of his lymph nodes feel normal. You can sit back. And lastly, I would check his axilla lymph nodes, and those feel normal as well. I would also feel for sinuses. Let me know if any of this hurts. I would feel, I'm going to have you turn your head just a little bit, frontal, ethmoid, and sphenoid, and maxillary. Is any of that tender?
No.
Would also feel his TMJ joint. Go ahead and open and close. Slide side to side and clinch. And that all feels normal. I'm going to grab a cloth. I would show that to my patient. I'm going to have you close your eyes and let me know when I touch you.
Yes. 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 Yes.
And that checks for V1, 2, and 3. Next, I'm going to ask the patient to close his eyes tight and open them. Wrinkle your forehead, stick your tongue out, puff your cheeks, and repeat after me. BMW,
BMW,
BMP,
BMP,
and have you clench your teeth and smile if I didn't have you smile, and that all checks V7. And I would also have him purse his lips, and that is normal as well. I will also feel for his lacrimal glands. I'll have you turn your head again for the camera. We'll feel around. Is any of that tender?
No.
So that is all normal. Next, I would move to his eyes. I would note that he has nice, full, thick eyebrows that are even. He has nice, full eyelashes that curve outward. And I will grab my light and go ahead and look straight ahead. I'm going to shine a light into your eyes from the side. I am checking his pupillary response. That is all nice and normal. And then I will have you cover one eye and keep looking straight ahead. Let go and cover your other eye. And that all checks for direct and consensual, and that is all normal. We will do the 6 cardinal fields. Go ahead and follow my light just with your eyes, not with your head. Ready? I'm looking for any nystagmus, extraocular movement, smoothness. Did you see double at any time?
No.
So that exam is within normal limits. We're also going to check his peripheral vision. Go ahead and cover an eye and let me know when you see my hand.
Yes. Yes. Yes.
Let's change eyes and let me know again.
Yes. Yes. Yes.
And that checks peripheral and confrontation. And I will also look at his conjunctiva and sclera. I'm going to shine a light again. His conjunctiva is nice and pink. His sclera is white and clear. I will move on to his ears. There is a nice normal external structure, and they are placed evenly on his head. I will begin to look at the internal structure. I will pull his auricle back, and I will look at the inside, and I see a nice pearly gray tympanic membrane, and I will switch ears and pull this auricle back. And again, he has a nice pearly gray tympanic membrane. I will look at his nose. He has a nice external structure. No flaring is noted. I'm going to have you cover one side and take a breath and switch to the other side. Do you feel like you breathe easy?
Yes.
I'm going to look at the internal structure. He has nice turbinates. They're not swollen. Skin color. And his septum is in the middle. I will also check his hearing with the tuning fork. I'm going to put this on the center of your head. Let me know when the sound goes away.
Gone.
Okay. And then we will check, that was the Weber hearing test. And then I will check the rind by placing this on each mastoid bone. Let me know when the sound goes away.
Gone.
And again on this side.
Gone.
And when I had it on the top of your head, was the sound equal on both sides?
Yes.
So that checks for air conduction and bone conduction. I'm going to go behind the patient for the whisper test. Please repeat these words after me. Bat.
Bat.
Cat.
Cat.
So the patient can hear clearly with the whisper test. Now we're going to check the hypoglossal, which is cranial nerve 12. I'd like you to stick your tongue out and try to touch your chin, and then try to touch each side of your cheek. And that is all within normal limits. Now I will look at his oral mucosa. Go ahead and open your mouth, please. It's nice and moist and pink. Underneath his tongue looks good. Please put your tongue to that side. And the opposite side. Everything looks good. All teeth are accounted for. His nice soft palate and hard palate. His tonsils are 1+. His uvula is midline. And then we will check for the patient's gag reflex. Go ahead and say ah. And he has a positive gag reflex, which is great. Again, moving down, I don't see any use of accessory muscles. I'm going to ask the patient to shrug his shoulders to check cranial nerve 9 and down. So that is normal finding. I'm going to look at his arms. He has nice normal muscle mass and hair distribution. His hands and skin are nice and warm. There's no clubbing noted. He has a good cap refill of less than 3 seconds. I'm going to have him squeeze my hands, and I'm going to have him make diamonds with each finger, which is nice and normal. Staying up here, I'm going to look at his trachea. It's nice and midline. I'm just going to feel down with the pads of my finger. Feel for the thyroid. He swallowed, and it rises nicely as expected. I'm also going to feel his carotid pulses one at a time. They are nice and strong. I will listen with the bell of my stethoscope. I'm listening for any bruits or thrills. And I don't hear that on either side. I'm going to check for his brachial pulse. And his radial. And then I'm going to have the patient put his arms up to check for arm strength. Don't let me push your arms down or up. And that is all nice and equal. Now I'm going to have the patient stand and turn so the camera can see your back, please. I'm going to lift your shirt. I'm going to look at his back. There's nice even skin color. His scapula are equal. I don't see any signs of kyphosis. I will have the patient bend forward so I can look at the rest of his spine. I don't see any signs of scoliosis. I'm going to feel down your spine. Let me know if anything is tender. Does any of that hurt you?
No.
Okay, please stand up. And then I'm going to check for the costovertebral. You're going to feel a little tap on your back. Let me know if that hurts. Any pain?
No.
And there.
Nope.
Okay. I'll go down to the 10th vertebrae and ask the patient to take a deep breath, and that is his thoracic expansion. Go ahead and have a seat, please. I'm going to move so that I can listen to his lung sounds. I will use the diaphragm of my stethoscope. Please take a deep breath. Again. I'm comparing each side. I'm listening for any adventitious sounds, wheezes, rails, bronchi. Take a deep breath. I'm also listening for clear lung sounds. He does have clear lung sounds. I will compare sides, and then I will also compare anterior to posterior. I'm going to gently percuss. I will also go down his sides, and I will also listen to his lung sounds on the sides. Take another deep breath for me. And again. And then I will check for his diaphragmatic excursion. So I'm going to tap again and ask the patient to take a deep breath and blow all your air out. And I'm going to feel again. Listening for the sound change, and then I would measure, and he is 3.5 centimeters, which is within normal limits. Okay, and then you can lay back, please. I would approach the patient from the right side. I would get down to the level of the abdomen. I'm looking for any bulging or pulsations, which I don't see. I would look just as an inspection. He has nice even skin tone. And then I will listen first, starting with the right lower quadrant. I'm listening for good bowel sounds, which he has. If he didn't, I would have to listen for 3 to 5 minutes. I will listen to his aortic artery, his renal arteries, and his iliac. Those are all normal. I would do a light palpation of the abdomen, starting with the right lower quadrant, watching the patient's face for any grimacing, watch the abdomen for any guarding, which he does not have. Does any of that hurt you?
No.
Next, I would look for the liver. I would go mid-clavicular down. I would start feeling, and then I would ask the patient to take a deep breath and let them know that that makes the diaphragm push the liver down, and I don't feel it, which is normal. If I did, I could percuss for the different sounds and measure. A normal measurement would be 6 centimeters to 12 centimeters. I'll move to the left side, mid-clavicular, and palpate for the spleen, which I don't feel either, but that is normal. I could also place my hand under his back to feel as well. I still don't feel it. While I'm here, I would feel for his left kidney. I would come to this side and feel for the right kidney. I don't feel either. If you're going to feel any of them, you're more than likely to feel the right. I would do a deeper palpation on each quadrant. Again, watching the patient's face and their tummy for any grimace or guarding. I will also percuss. I'm listening for any dullness or any tympany, and everything sounds normal. Oh, and I would also listen for his femoral artery sounds. And then I will feel for his lower pulses. I will feel for his popliteal. Those are normal. He has nice 2+. And I will feel for his dorsalis pedis as well. Looking, he has nice even muscle mass again. Hair distribution. Cap refill is less than 3. His toenails look nice. Go ahead and push against me and pull back towards you. And then I'm going to grab my cloth and a pen as well. I would like you to let me know if I touch you with something soft or sharp, okay?
Soft. Soft. Sharp. 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 Soft. 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 Sharp. Sharp. Soft.
And that is all normal. Next, we will check his reflexes. I will have the patient sit up, please. We will check for reflexes and the conal radius checks for C5 and 6. And then I will check his knee reflexes, which checks L2 and 3. I will also check his Achilles. I will hold your foot while we check it. And those all appear normal. And I would listen for all heart sounds. Go ahead and lift your shirt up again. I'm looking at his chest. Again, nice even skin color. I will feel for the precordium, the apex, and the base of the heart. And I will listen at the second right intercostal for the aortic, second left intercostal for pulmonic, third intercostal for herbs, fourth intercostal for tricuspid, fifth for mitral. I'm listening for any heaves or thrills. I don't hear any, but I would listen again with the bell of the stethoscope. Second intercostal right, second intercostal left, third intercostal left, fourth intercostal left, and fifth. Again, listening for any heaves or thrills. I don't hear any. I will have the patient lie down so I can listen to the heart sounds again. I'm listening also for normal heart sounds, S1, S2. And all of his heart sounds are normal to me. Go ahead and sit up, please. I would check also tactile fremitus. I will have the patient repeat after me. 99,
99.
99,
99.
99,
99.
and then I will change my hands. 99,
99. 99. 99.
and then we will repeat that in the front.
99. 99. 99. 99. 99. 99.
I didn't hear any changes in that text for tactile fremitus. I would ask the patient at this time if they felt like we had examined anything or if they would like anything else examined or looked at.
No.
And then that would be the end of our exam. Thank you so much.